Hello, my name is Sandy Underberg and I'm the founder of Diabetes Support Services. My guest today is Rachel Lamb. Welcome, Rachel.
Hello.
So nice to have you here. As our audience will find in a few minutes, we're going to hear a little bit of an accent. Would you please tell them where you are from?
I'm from Perth in Western Australia.
Okay, and what are you doing in Salem, Oregon?
I'm studying at Willamette University. I'm on an exchange program, so I'm there for a year.
Wonderful. And you and I have a common thread. We both have been living in a household with diabetes, and you yourself are a diabetic, is that correct?
Yes, I have type 1 diabetes.
And how long have you been a diabetic?
Since February 2009.
2009.
So just over two and a half years-ish.
Okay, I see. Well, our co-founder, my husband, has been a diabetic for 48 years, so we have sort of walked the walk and started these diabetes support group meetings almost 4 years ago now to help people out. And that's how you got in touch with me when you heard about what we were doing here. So we're going to talk about that in a little bit. But first, just in case somebody isn't familiar with diabetes, let's talk about what it really is. I have a cheat sheet, so I don't have to prove it. Diabetes is actually a defect in production of insulin that is made by the pancreas, and you are a type 1. So that means that it's caused by an autoimmune mediated destruction of the insulin-producing cells. And so, from what I understand, the pancreas just basically throws in the towel and quits.
Yes.
More prevalent today and growing at epidemic rates is type 2 diabetes, which is interesting, and that really is related to excess weight, inactivity, and family history of type 2. So it was interesting. I was researching diabetes in Australia, and there are a lot of parallels to what's going on here in America. However, are you familiar with the statistics there at all?
I've heard them and I know they're quite shocking, but I couldn't rattle them off for you.
So well, I can rattle off one or two. Yeah. Back to my cheat sheet.
Yeah.
I discovered that there's 1.5 million diabetics in Australia, and it's just like here in America. The rates are growing rapidly. 85% of those people are type 2, and there were studies that were done in 1999 and 2000, and they discovered that the Aboriginal and Torres Strait Islander communities have the highest rate in the world. And so I don't know if you're familiar with that one or not. That's rather interesting.
Yeah, my uncle actually works in the Northern Territory as a doctor with a lot of Indigenous health, and he sees a lot of type 2 diabetes. When I got diagnosed, he was talking to me a lot about it. Okay. So I know it is a big pandemic, and it's a big issue, but they often find that in those sort of communities there is a high incidence.
Now, one statistic went on to say that in some Indigenous communities, as many as 1/3 of the population have diabetes. You know, that's very high. We've heard the statistics from places like the American Diabetes Association and such, that 1 out of every 3 babies born in the year 2000 will become diabetic in their lifetime if conditions don't change, and 1 out of every 2 minority babies. So we're dealing with something that is very serious. So first of all, let's talk about the comparisons of health care in the United States. Here, of course, those who are diagnosed go to their family practice doctor. Hopefully they have insurance, and they're sent for education and such. What happens in Australia with a new diagnosis?
Well, I can talk about my personal experience.
Perfect.
As a type 1. My condition kind of went unnoticed for a while. I was seeing a doctor and we couldn't quite figure out what was going on. I had all the classic symptoms, thirst, and I'd lost lots of weight, and I was constantly drinking water, and I had muscle cramps and just all the classic signs, but we somehow seemed to miss it. And then I went to a GP, and I had a blood test, and then the next morning I was actually admitted to hospital, and I stayed overnight there for 4 nights. So, but that was because my blood sugars were quite high, and I just sort of turned 18, so I was still kind of in that child-adult realm. But I've spoken to a lot of diabetics in Australia, and most of them seem to get checked into hospital.
They do.
There are a few that will just sort of get diagnosed by their family practitioner, but with type 1 being a lot more life-threatening,
Mhm.
especially when blood sugars are so out of
Mhm.
control. Hospital is a very common thing.
Mhm. Now you're on a different system for logging blood sugars than we are
Yes.
here.
Yeah.
So high blood sugar here, and that would probably result in a hospitalization, would probably be in the $500 to 600 range.
Mhm.
So what are your what is the comparison on that?
Okay, so I'm not 100% sure about the 500 to 600 what that converts to.
Mhm.
My maths isn't that good, but I know that you guys are on Gmols and we're on
Mhm.
millimoles,
Mhm.
and so our range, you multiply that by 18 to get yours.
Okay.
So if you divided the 500 or the 600 by 18, you get our range. But I know that our blood sugars we're told to keep between 4 to 8 millimoles, and I know that translates to about 72 to 144 Gmols. So that's how that sort of translates.
Oh, good explanation. So was it difficult when you came here and had to think in the American way, or haven't you done that?
Well, I've brought all my own testing kits with me, and so I haven't had to really do that for my own personal care. But when I relate to other people, like if I've come across a diabetic and said, oh, my blood sugars are 1.8, they flip out because comparing that to your scale is quite drastic. So
Right.
in terms of getting support, I've noticed it then, because when you're trying to compare, you sort of have to have your calculator with you and
Right.
be doing that. So
Very interesting. It's interesting. So are you on an insulin pump?
yes, I am.
Okay, and have you been on that the whole time?
No, for the first year of my diabetes, I was on injections,
Mhm.
and then just after my 1 year anniversary, I went onto a pump. So I've just celebrated my 1 year pump anniversary.
And how are you enjoying that?
I'm loving it. I really think for my lifestyle, there's no comparison.
Absolutely. Gives you a lot of freedom.
Yeah.
It's been a lifesaver for my husband.
Yeah.
Absolutely. And what about the continuous glucose monitor?
I am not on that purely for the cost and the inconvenience
Mhm.
that you'd have to wear 2 different infusion sets.
Exactly.
I know they're working on a closed loop
Mhm.
system, so when they develop that, I'll definitely look at it then. But I hate having to do the cannula change every 3 days, let alone doing 2. So
Absolutely.
Yeah.
Absolutely. And that is one of the big disadvantages.
yeah,
And it sounds to me like you have your blood sugars pretty much in control.
Mhm.
So to me, somebody who has unexplainable fluctuations like my husband does, that
Yeah.
continuous glucose monitor is a tremendous help.
yeah.
Let's talk about the cost to the patients now. You are on a different system. You do not have medical insurance such as we do here in America. Is that correct? What kind of medical program do you have?
Well, we have Medicare, which is provided by the government, and
Okay.
that's quite extensive. I haven't studied the comparisons in any depth, but I have talked to a few diabetics here, and the cost seems a lot greater for diabetics in America than it does in Australia. And I actually pre-bought all my insulin and all my consumables before I came here, because I was under the impression it was going to be quite expensive here. And I also have private health insurance at home, which covered everything in hospital, so that I incurred no cost there.
I see.
But the private healthcare does not cover the cost of insulin or consumables. The government actually covers that. We have a scheme called NDSS, which is National Diabetes Services Scheme, and you get it once you're diagnosed. You sign up to NDSS, and it's for type 1s and type 2s. And I'm sure gestational diabetes as well, and you get a card, and then you just take that to your pharmacy,
Mhm.
and you get the discounted rate, so
Uh-huh.
it makes it a lot more affordable.
I see. Well, that's excellent. I know my husband's insulin pump, he just got a new one last November, and the cost, had we paid for it without
Mhm.
our insurance programs, would have been $7,000. The cost of the continuous glucose monitor is $1,000. But that's the small part, because the annual figures work out to something like about $10,000 a year for the infusions and the sensors that have to be replaced every 3 days. And so it's very expensive.
Yeah.
So one of the things that I came across yesterday in my research is a website that talks about the OSD-RISC test. Are you familiar with that? Did you do that when you were first diagnosed?
No, I didn't, because I think that's more for type 2s, and I'm not familiar with it myself. I feel like I might have heard of it on an advert or not, and I've been here for 8 months, so I'm not really that familiar with it, no.
Okay, this is interesting to me because it is to determine the risk of it for type 2 diabetes, and it's a series of questions that a general practitioner has when he sees a patient, and it sounded like it was pretty much standard to give to anybody. And so they have this paper test that they fill out, answer these questions, and if they score higher than 12 points, and I didn't get the full explanation on how that works, they are referred to a diabetes risk prevention program. And so it's a non-clinical tool, and it helps predict a 5-year risk for type 2. And so that's kind of interesting because of the pandemic, like you said. It would be a very important tool, and I'm not sure whether the doctors in America are using it.
Yeah, that's what I was going to ask.
Yeah, I haven't heard of any of them that are. So that's interesting. So tell me about the educational tools that are provided. When you were diagnosed by your family practice doctor, were you sent, first of all, were you sent to an endocrinologist, or did you
yes.
were? Okay.
The support I received in hospital was just phenomenal. So I was in hospital for 4 days, and I was diagnosed actually over the weekend, so I had to wait until Monday to see an actual diabetes educator and an inpatient endocrinologist who just quickly checked everything. And then they just basically wanted to make sure my blood sugars got down to stable rates and that I was safe to discharge and had enough knowledge to sort of get me through the week. And then they booked an appointment with me in the outpatients clinic. I think it was within like 1 or 2 weeks. And I received so much support there. I saw diabetes educators, I saw endocrinologists, nutritionists, they have access to psychologists if you want, and it's all free. And I could go back as much as I wanted. I was booking appointments every few weeks at the beginning, and yeah, they quickly became very good friends, and I still keep in contact with a lot of them today.
Wonderful. It's kind of scary, isn't it?
It's very scary, and it was very scary for my mother as well, I think.
Oh yes, absolutely. Moms are like that.
Yes. Yeah.
What is the size of the family you come from?
I'm the oldest of 4 children.
Is there anyone else in your family who has diabetes?
There is nobody who has type 1, no. I'm the first in my immediate family. Yeah.
Yeah, well, it's kind of a mystery yet to the doctors. They don't quite know what causes it.
Yeah.
And so...
it's frustrating hearing that over and over again, but it's true, yeah.
It certainly is. Well, so you and I have something in common. You've started and facilitated a diabetes support group. Let's hear a little bit about that.
So after I was diagnosed, like you talked about, it just being really scary, and doctors tell you one thing and then your body tells you another, and it's just a very confusing time. So I was very keen to talk to other young type 1s, and it was weeks, and I hadn't spoken to a single person. The only person I was getting information from was doctors, and as I'm sure you know, the support groups provide a whole nother level of support. And my diabetes educator, Patsy, was actually talking to me that there was just nothing for young adults, because I'd actually just missed out on being able to take advantage of the camps and everything they ran for small children, because there is a lot set up in Perth, in my town, for small children diagnosed, and there was a lot of support for older patients, but there was just nothing for that gap in the middle. And so she was very keen for me to start something, so she got me in touch with 2 of her other patients, Mitch and Ryan, and we all met up for coffee, and then we just discussed the lack of support out there for us and the great need for it. And we decided on a name, we set up a logo, we set up a Facebook page, and it just went from there.
Okay, tell me, what is the name?
YWAIT, Young West Australian Insulin Takers.
Okay, and so you basically work with young people who are diagnosed type 1?
I mean, and that was the thing that we talked about is how do you just sort of define young. We are specifically for type 1s, just because we feel the conditions are so different, and we all come from a type 1 background. We couldn't possibly give support to type 2s, but we do often get a lot of type 2s who email us, and we can refer them on to the support group that we know of. So we are a contact, I guess. But yeah.
So here in America, support groups aren't very common at all. And so it's the same situation there.
Okay, yeah.
And so how often do you meet?
We aim to meet once every 2 to 3 weeks, and we often do things like we go rock climbing, or we go bike riding, we've gone bowling. If a guest lecturer is coming to town about diabetes, we'll publicise it and hold events and do things like that.
Well, you're giving hope to these people who are newly diagnosed, whether it's type 1 or type 2. You can be active. You can participate in sports. You can mow your lawn.
Yeah.
You don't have to crawl in a corner and shrivel up.
Absolutely. It's nice to have a forum to express that, but also just to express the frustration as well. Because I think that's one thing when you're newly diagnosed, or when you have had diabetes for years, is that when you talk to friends and you say, oh gosh, I was 1.8 last night, and they just have no idea what you're talking about. It's nice to be able to discuss that in a forum where people actually can empathise with that.
Do you encourage these people to tell their friends and their family members? This is one of the things that we come across a lot, that people are a little bit as if they're ashamed of it, or they feel a little lesser because they have diabetes, and they're afraid to tell people what to do should they have a low blood sugar. And so are those the kind of support things that you do as well?
Yeah, I mean, absolutely. There are people that I've met that choose both paths. Like that either they'll tell certain people, or they won't tell anyone at all. Or when I was first diagnosed, I wanted everyone to know, and I wanted to share the experience with everybody. My mum sat down and told all my friends about what to do, pulled out the glucagon pen. And then I think you can take it a little bit too far, because then it becomes invasive. People feel that they have the right to tell you what you can eat, what you should be doing, and your lifestyle habits. And I mean, that's a whole other thing to deal with when you've just been diagnosed and you're trying to deal with the actual diagnosis. You have to deal with all these social factors too. So I learned to sort of tone it down a little bit and tell certain people. And I think you definitely learn who you can tell. I mean, you don't have to go telling your employers if you don't want to. You don't have to tell certain people. But I definitely think it's important to involve the close people in your life, just so that they can offer you support, and also so you can educate them as well. I mean, I'm sure they want to be involved.
Absolutely.
So, yeah.
Well, the other important part of that, by educating people, they might have symptoms. Like you said, you had symptoms and you weren't aware that they were symptoms of diabetes.
Yes.
And so people should have an understanding of what the symptoms are. And you mentioned a few of them: the excessive thirst, having to go to the bathroom often. Did you say leg pain? Was that one of them?
Yeah, I had actual cramps in my legs from the lack of glucose getting to my muscles. And I just thought, it was summer in Australia. I'd been on holidays up north, so it was so hot, so of course I was drinking lots of water. I was snorkeling every day, so of course I was losing weight, and then I hadn't been to the gym in a while, so my legs were cramping, and it was very easy to make the connections. I mean, it was all a little bit bizarre, but
not only the connections but the excuses.
Absolutely.
The denial.
Yes.
If you go into denial saying I don't have to do anything about this, probably not, because you ended up in the hospital.
Yes, no, I didn't go into denial, but I was confused by it, and I mean, I went and saw a doctor, and she didn't pick up on it either. So so it was just confusion. It was more I thought I was maybe going a little bit crazy. Maybe I was being very sensitive about my body. It was just confusing.
That surprises me, because I hear that story all the time. The people have been to the doctor 2 and 3 times. You think with this epidemic of diabetes that we have going on and all across the world, that the first thing they do is do a blood test.
Yeah, it's so simple. And yeah, I mean, I was speaking to a girl the other day at Willamette who was saying that her doctor suspects that she might have diabetes, and she hasn't heard back about the blood test in like 3 weeks. And
oh my word!
I mean, it's so simple. I offered to test her blood sugars myself, because I just thought it's such a simple thing. I mean, it turned out that she didn't have diabetes, so she wasn't at risk. But it can be so life threatening, and
absolutely,
it's so easy to test for. I don't understand.
And running high blood sugars can be damaging to the organs.
This
goes far beyond just having a disease like diabetes, but you can have kidney problems, you can have heart problems, and a lot of things that go on along with it. And so people need to educate themselves about it, and that's what we try to do at our diabetes support group meetings.
Yes.
And so tell me, I just found out about this. You received some kind of an award, and what was that all about?
Oh, well, not an award. just before I left, I actually got the invitation to apply on behalf of Diabetes WA for the Youth Leadership Conference in Dubai, which is being held in December by the International Diabetes Foundation.
Wow.
So I found out while I was here that I actually got accepted. So it's
Congratulations.
Thank you very much. I'm very excited about it. I'm a little bit unsure as to what exactly is my role or what exactly we're going to do, but I know I'm obviously going to learn a lot about diabetes, and I've already started to meet a lot of other young representatives from around the world, and we've spoken on Facebook, and we're meeting on Skype soon, so it's going to be a great avenue to discuss issues and talk about topics and brainstorm some solutions and
amazing.
Learn some stuff.
A few months back, you invited me to Willamette University to talk about the Big Blue event that you had there, that you organized there.
Well, National Diabetes Day, which is on November 14th, World Diabetes Day, just basically celebrates, or tries to raise awareness about diabetes and the pandemic and the symptoms and just the risks. And it's a day that I really like to just come together with a lot of diabetics, and it was really hard for me to be in a new country for this day after being newly diagnosed, and I really wanted to meet up with some other diabetics, so I tried to see what was happening in Salem, and it didn't seem like there was a lot happening at Willamette or in Salem, so I found out about the Big Blue test, which I think is organised by the IDF. I'd have to get back to you on that. But it's a test that's held on National Diabetes Day, where participants test their blood sugars before they do exercise, and then they do 14 minutes of exercise and then test their blood sugars after it, and then can post it online. And it's just a fun way to get involved and raise awareness about diabetes, and it's interesting to see the results.
Right. You did a lot of really interesting things at Willamette to involve the students. I remember you had talked to the cafeteria about serving blue food.
Yes. Well, I talked to the cafeteria and they promised me they were going to serve blue food, which didn't actually end up happening, but they were talking about serving things like sugar-free blue jelly and having blueberries and things like that. But, I mean, it didn't happen. But there are obviously a lot of things you can do, and I actually got the clock tower on campus lit up blue, and that's a very common thing around the world. I know that our bell tower back home is lit up blue, and I'm sure a few other landmarks around the world. So it's slowly gaining awareness as everybody's realising what a big issue diabetes is.
Absolutely, and it needs to be. So you inspired me. It was fun going over and participating with you that day. I didn't exercise.
But I'm sure watching was funny.
Watching was a lot of fun.
Yes.
That one poor girl who participated, I thought she was going to die.
I pushed them hard, didn't I?
You did. You were a real taskmaster. But that's wonderful that you have had this involvement. You really made a mark in Willamette University and in Salem. It's been great meeting you. Is there anything else that you want to talk about as far as being a diabetic as a young person and what the future holds for you and such?
I mean, I think obviously I'm still learning a lot. I've only had it just over 2 years. But I think it's very important not to let it stop you. But at the same time, you have to find that balance between making accommodations in your life. You do have to recognise it as a risk and be sensible and mature about all the risks. But at the same time, not let it stop you do anything that you want to do. And that's really been my mantra throughout my whole diagnosis, is not to fit my life around diabetes, but make diabetes fit in with my life. But yeah, just figuring out what that is can be quite challenging. And so I think it's so important to get involved with a support group and just vent the frustrations, because sometimes it is, you just need to vent it.
Absolutely. You can call me anytime.
Thank you.
From wherever you are, Australia, on your travels to Europe, wherever.
Thank you very much.
But I think I'll probably be learning more from you than you would from me. One of the things I think that sometimes the medical professionals fail to teach a diabetic, and even a new diabetic, is what I call the snowflake syndrome, where everybody's different. And I don't think people should be classified as having to do this, and this. I think a person has to learn their body, learn how they react to different foods, understand medications and that kind of thing. Do you agree with that?
Absolutely. I think that was that was a very, very, very frustrating thing about being diagnosed, was that they told me to do this, this, this and this, and then and that I should expect these results, or I should do this in order to keep my blood sugars down. And then when I was so rigorous at the beginning because I was so scared and I wanted to get things completely checked, and my family were very worried about my health, so I followed all of their instructions to the T, and then I would come back to them with these results, and they would just say to me, oh, well, everybody's different, and it just frustrated me so much, and I definitely felt very lost when I was firstly diagnosed, because I felt like I was doing everything right, and that I think is one thing about having type 1, is that you put in this effort, and you sometimes you just don't know whether you're going to be high, you're going to be low, whether it's going to work, whether your body is going to respond, and that can be one of the most frustrating things. So yeah, I definitely agree.
Right. And you know, you go to the doctor, you say, why is this happening? And he says, it's diabetes. Come back in 3 months.
Yeah. Which is completely true.
Yeah,
but you don't want to hear that when you're well, I guess you don't hear that ever, but especially when you're firstly diagnosed, it can be very scary because you just don't know what to do.
Now that you're a couple years down the road, is your mom doing better?
Yeah, she is. She's doing a lot better. I mean, she has to have let me come away for a year. So yeah,
that was very brave. Very, very brave. Well, give her a hug from me when you see her. Maybe someday we'll meet. That would be wonderful. Do you have anything else you'd like to say, Rachel?
No, I think that everybody who's living with diabetes is just doing an amazing job by tackling it. So.
Right.
Good luck.
Good luck, right. Well, I'd like to invite everybody to come to our diabetes support group meetings. We meet the 4th Thursday of every month, 7 o'clock p.m. at First Presbyterian Church, and that's on Chemeketa Street, corner of Chemeketa and Winter. The meetings are completely free, and we provide information for both type 1 and type 2 diabetics. Every meeting has a medical professional from the community who is given at least a half an hour time to speak to the people who come. We have tips on exercise and diet tips usually. We might have a vendor of diabetic supplies who will come and talk about their products. And so we try to round out the meetings, and they seldom last an hour. Some usually we run over to an hour and a half. And we do have a program for children. The children can go with Sticky, our porcupine mascot, to the My Pal Sticky program, and he entertains them for the time when the adults are meeting with the doctors and such. So we would like to invite you to come anytime. If you have any questions, go to our website. It's www.diabetessupportservices.com, and our phone number is 503-585-1335. Thank you very much, Rachel. It's been wonderful having you.
Thank you for having me.
Okay, bye-bye.